tools. So we're going to give all of these to you, and you'll integrate them into what you're saying tomorrow. So Maurizio, I'm looking at this. There's a number of ones about depression. This is an interesting one. And while you're reading it, here's one that I'll take. Are there any foods that can reduce stress? And my answer is the foods that my mother cooks.
I heard that a depressed person can never know that he's depressed until someone else tells him. Is that true? Well, I think it may be true in some cases, in the sense that we're sometimes we have a hard time recognizing in ourselves signs or symptoms that suggest that our behavior has changed. So for that reason, people have developed self-rating scales that are available in English, in Arabic. Where you can in some ways read those questions aloud, fill them out, answer, and then it automatically tells you, well, it looks like you're depressed or not depressed, and you can use that as a tool to then talk to a doctor or mental health professional to get a confirmation of whether that is true. So I think in general, the people who know depression are the family members. They often, sometimes, the patient comes in for the first visit, and I always ask the family member to come in, and the patient says, well, I think I may be depressed. I haven't been feeling well for the past few weeks. Then you bring in the family member and says, well, it's been like 2 years, 3 years that we've seen, he no longer does this, he stays in the room and all that. In fact, one of the things you were mentioning, importance of prayer as a way of reduction of stress. One of the things that depression takes away sometimes the interest in religious activities. We have many patients who stop going to religious functions, they stop praying because of the depression. So that's a common thing that people will say, we've seen he doesn't pray anymore and so forth, and that's a classic sign.